Good morning. Hello. Welcome to our Wednesday live show. Today, I want to talk to you about an amazing carbohydrate that is naturally occurring, that has an amazing capacity to your immune system. If you're curious, amazing antiviral activity. So I am very excited to bring you more news about that today. But first, this is our COVID surge update news show. Part of our show is going to be news related. The second half is going to be about this polysaccharide that you'll want to add into your arsenal of resources. So good morning, everybody. Looks like we may be running a little slow on YouTube. It seems that one of the things I've noticed on YouTube, and by the way, Instagram, I think you guys are on. Let me see. Let's see. I don't know if Instagram, I guess I didn't bring up Instagram. Okay, so let me bring Instagram up. One of the things that I found in our live shows is that, let's see, I'll turn that on. Anytime, that's weird. Instagram's not even letting me go live now. One of the things that I have noticed is that when schools are on, YouTube runs a little slower. So I don't know if you guys experience that. But okay, now I'm going to connect up to Instagram. So good morning, everybody. Hello, Instagram. You guys are on. Yay. So today we're going to talk about an amazing substance, naturally occurring fiber, that is a carbohydrate that will greatly enhance your antiviral capacity and support and bolster your immune system. So that will be the latter half of our show. And let's dig into the news, friends. And definitely, if you are watching on the live or the replay, hit the like button. Let me know you love this content and hit that share button. Let's bring more people into our community to spread the good news of health and wellness from a natural perspective. Okay, globally, our world is at a total of 68.3 million coronavirus cases. The US has now moved to 15.2 million cases. We had over 210,000 new COVID cases just yesterday alone, and a total of 1,891 fatalities, now making up 288,583 total fatalities. I just sort of want to remind everybody, the coronavirus, COVID-19, the co-infection with SARS-CoV-2. This is now the number one leading cause of death in the US. Okay, it has surpassed heart disease and cancer as a leading cause of death. If you are in denial of this, it's time to wake up to some great facts about this virus. And if you follow my show, I will equip you with a lot of great natural resources to help support and fortify your immune system. But that alone does not help us prevent this virus, and we'll dig into more about that. Now, I do want to share with you a whole bunch of news worldwide. Yesterday, the UK kicked off the first COVID vaccines with Pfizer's drug. We had our first individual. She was over 90 years old. I think she might have been 92. I'm not sure. But she was really cute. She was, number one. And then number two, ironically, and true English style, William Shakespeare lined up for the second dose of the vaccine. And so I thought that was kind of funny. But it is now, the vaccines have been out there. The more thoroughly vetted vaccines, I should say, have just kicked off yesterday. The Chinese and the Russian vaccines are out there. This is really interesting to note with Russia. One of the challenges with them rolling it out really fast, and now they're advising individuals that if they vaccinate, they cannot drink alcohol for 2 months. And apparently that has the Russians, only a quarter of them are actually signing up to be vaccinated strictly because of the lack of alcohol consumption that they can consume in a 2-month period after that first vaccine. China is indicated that the small town, actually where the pandas are, I've been to this town, it's called Chengdu, and it is where they have their panda research center, where all the baby pandas that go to all the zoos. Chengdu is the hub. They have a cluster of 6 cases. It's going to sound like it's not a lot. Again, everything is relative. from the US, but 6 cases is enough for the Chengdu area, the city. They've tested 250,000 residents for COVID, and they've started to employ lockdown measures. In Spain, in Barcelona, we have a case in a zoo where there are 4 lions who have been infected by humans with coronavirus. The 3 of the 4 are female lions, and 1 is a male lion. I don't have any other reports than that they're showing respiratory distress. But this is, again, another case like I reported on Monday. Humans have been giving the mink farms and the little mink creatures the virus. They've been more susceptible, as we see the felines, bigger felines like the lions and the tigers, as we saw in the Bronx Zoo. So Barcelona has 4 infected lions. And Canada is showcasing cases. Make sure I'm mic'd. Canada is having an increase in cases. They've identified that they've had some complacency recently, and they have had their caseload currently is 10 times higher than it was in the summertime. They have a lack of testing right now that is happening. And apparently the latest report that was out late last night, potentially early this morning, I just read it. It talks about the nursing homes and the long-term care centers have been greatly missed by the procedures and process of protecting them via testing. 80% of Canadian deaths are coming from nursing home and long-term care centers. That's actually higher than what we're seeing in some of the US cases. Now, I also want to highlight that we are seeing greater cases in communities that have not necessarily had the virus. And so we're seeing some community spread through travel internationally. The US is supposedly first, we're starting to see the very beginning stages of the Thanksgiving swing, or the wave that is beginning. And I'm going to share some really crazy information with you that is just kind of hard to digest living here in the US to think that we're doing this. But right now, we have 104,600 individuals in our hospitals. And 1 in 22 individuals who gets tested is going to test positive for coronavirus. We are now seeing hospitalizations starting to decrease. And the reason behind this is simply because some people are being sent home from hospitals because of the capacity, and they're being sent home to convalesce where they would ordinarily be admitted. This is really concerning because a traditional admission would receive maybe some antiviral medication. Maybe they would receive a certain type of oxygen therapy, and they would be there if they declined quickly and rapidly, and that's not happening. And that is the beginning of something that might be really tragic and might lead to additional fatalities where people are convalescing and dying at home where they should be in the hospital. So this is the underpinnings. It's an approach that some medical facilities and a lot of these rural communities are having to deal with because of meeting and exceeding capacity levels. I do want to highlight, we've got a lot of changes in just the last day or two in terms of growth and expansion of cases. California has over 25,000 new cases in a day. California, 2 of their areas, 2 of the regions, Southern California and Central Valley, hit their ICU bed capacity exceeded 85%. That's the threshold when the governor creates and puts out stay-at-home orders. Those 2 areas they now join San Francisco area in a stay-at-home order of 3 weeks. That covers, it is the 9th. 3 weeks puts us right to New Year's holiday. So this stay-at-home order is also lapsing the Christmas, the Hanukkah, the Christmas, the Kwanzaa holidays, and the beginning of New Year's. We also have seen in LA, there was a big case that restaurants won a lawsuit over the LA County for closing outdoor restaurants. The apparently they weren't able to showcase the evidence that it was unhealthy or unsafe to have restaurants maintain outdoor dining. So that's really big in the restaurant world, but it doesn't change the fact that there are all these stay-at-home orders and there are curfews where even if they do outdoor dining, they have to stop by 10, or individuals will be in violation of that. Florida has had an increase as well. They had an increase of in a day, 7.9 thousand new cases, and the governor apparently there's been some grief there where there's a new judge in this one area, and the governor was able to get a search warrant for the statistician who was in charge of the Florida Department of Health dashboard. When she was fired in June, she started her own and was pulling data from all over. And it was actually showcasing that the state of Florida is not announcing and keeping track of all these details. She was even keeping track of the 25,000 kids in Florida schools that had contracted COVID. Well, they came and raided her house at gunpoint with her kids at home. I believe it was Monday, or I think it was Monday evening, sometime Monday, maybe Monday morning. But that's a really big case in Florida. And there's been some people who've left the Florida administration because of it. So it's definitely something we'll monitor. But I also want to highlight that Texas had 13,000 new cases yesterday. New York exceeded 10,000 cases. Ohio, if you live in Ohio, you guys are in quite a world of increasing numbers. Ohio posted 25,000 new cases. They are at a 6.5% positivity rate. 24.6% of all hospital beds are occupied by COVID patients in the state. A quarter of Ohioans who are hospitalized in Ohio hospitals are COVID cases. That is insane. 1 out of 4 hospitalizations in the state of Ohio is from COVID. Okay. Also in Ohio, there was a nightclub that hosted a 500 plus party. Some rapper who apparently the next day flew to Atlanta and hosted some sort of indoor adventure party. The nightclub has been fined, and these 500 people at the party, there's a lot of social media. Nobody was wearing masks. So there's still a lot of craziness happening where people are not taking it seriously and violating public safety. Arizona right now is having a major increase. They have set records. Yesterday, they had over 12,000 new cases. That's significant in one day. Their positive percentage rate is 10.6%. And Georgia, the first week of December, we posted a 50% increase in 1 week over the previous month. So Georgia's in a spike. And actually, when we look at hospitalizations in Georgia, the kind of northwestern area, actually where we are, kind of the beginning of the foothills, our hospitalizations have greatly increased. Now, I also want to highlight that North Carolina, they set up a curfew and a stay-at-home order, but it's mild in North Carolina. The curfew begins at 10 p.m. and goes to 5 a.m. Restaurants and bars have been a part of that. They are now requiring to-go type of orders, and entertainment venues, that applies for that. Washington State has extended their current restrictions to the 4th of January. And that includes restaurants to go and outdoor dining are restricted. I will say that Washington State has put a total of $180 million. So this next course, they posted $50 million of relief. So Washington State is producing financial relief for small business owners and individuals in that state. That is not something that we're not hearing a whole lot in other states. And then I want to highlight really big news about the FDA. We have a lot happening this week. We have 2 vaccines that have posted or sought emergency use authorization for the vaccines. The first one is Pfizer. That's what we're going to talk about right now. Pfizer has they're first in line for the scrutiny. And so they sought the emergency use authorization. The FDA then digs through all the data. The FDA reports on it. That report came out yesterday. So I'll highlight the report. It's actually really good. It's actually better than what the company had been putting out. And then the second phase of this is tomorrow. Tomorrow's a really big day. We have the FDA, and there is a body, this clearinghouse that is separate from the FDA, are going to meet and hear public comments. Now, these are public comments from clinicians, physicians, scientists, individuals that are in expertise, that maintain expertise in virology and vaccines and research. Actually, our pediatrician back at home, who's a holistic pediatrician, he will be very excited. He's going to be one of many voices who's going to be voicing some concerns about transparency regarding the vaccine and just information we need to know that we don't know about. But, there are some things that have come out that are not completely clear and transparent, and that we need probably more information for the public to feel comfortable with. So I want to highlight some of that. But first, this FDA report is really good. Looking at and digging through this information, what they find is that with the first set of the vaccine, so we have two vaccinations. One is the first one, and then the second one is administered 28 days from day one. That first dose, within 10 days, people are showing there's efficacy. It's a 50% efficacy in terms of the protection. So by day 10, people begin to get the protection to ward off a viral invasion of coronavirus. That's really big. Now, by the second dose, 28 days later, they're showing upwards of 96% efficacy, that it gives protection of 96%. It's really 94 to 96%. One of the things that this puts this vaccine, now it's an mRNA, so this is a very different type of form of immune supportive and immune recognition of this virus. One of the things that they're seeing is that this is in line with the polio and the measles style vaccine efficacy. And that is really positive in terms of just the nature of our outbreak, just how overwhelmingly the community spread is and how contagious this is. So this is very positive. The other thing that I want to highlight is that on Thursday, this is when we have the big meeting. Thursday, more than likely, there will be a vote. There will be the FDA-related parties who vote, and there will be the nonpartisan advisors. That it's a clearinghouse. It's a particular a nonpartisan, non-FDA-related body that will hear comments like from one of our clinicians, physicians in our family, and will make a determination whether they feel that the emergency use authorization, if Pfizer's met all the qualifications, if it meets public safety. There are going to be a lot of questions that are asked. And one of the things that we might be faced with is we might have a lot of questions and we might still see this move forward. And some of the things that I want to present to you, because we need to be aware, and the transparency is going to be critical. Some of the things that we don't know right now are post-vaccine studies. Are there plans for Pfizer to conduct ongoing post-vaccine studies about subpopulations in different ethnicities, different socioeconomic groups that maybe have pre-existing allergic and hyperinflammatory autoimmune conditions? That we don't know that if they're going to do that. I would like to see that also in the pediatric and geriatric communities. Do know the pediatric communities we haven't had that testing. They've even had reports that maybe 2022 we'll see kids being a part of this. The other thing is we're not right now in the reporting showing details of the post-vaccine adverse events. So there potentially are post-vaccine adverse events, but the reporting and the details aren't there. But one of the things is that while this process has been transparent, some of the details, some of the reporting hasn't. And part of that is just the speed of this. And a lot of clinicians want to see more information. And that is very much in line with what we see for the polio and for the measles vaccine. We are just asking to see more information so we are equipped and can educate people appropriately and answer questions. The vaccine, one of the things that we want to know that hasn't been released is identifying the specific vaccine with the particular patient number and the administration of each of those individuals. So the tracking, details about the tracking. Also, current vaccine effects on individuals who have been previously infected or who are currently infected. So if people, and we do know these vaccines had to hit a threshold where 50 people had to be exposed to and actually contracted COVID-19. How does the vaccine play out when a person does contract COVID-19? Does it completely reduce all symptoms? Are they asymptomatic? Those are just questions that are being posed right now. The other thing too is we don't have a minimum of 6 months tracking. We want more time also to identify details. Other questions, how does this affect pregnant women? Was that part of it? How long does this last? There are just questions we won't know because of the timing. But those are things that are going to be put to this body, the FDA representatives tomorrow, and this private vaccine assessment committee. And some of the clinicians are, the director of Harvard Medical School's infectious disease program. There are going to be, global vaccine experts. There are going to be folks in the science and the data generating factors, the epidemiologists. There are going to be all of these folks, and that's public knowledge who all is on this the panel who will vote to say yay or nay to Pfizer. And obviously there's a lot of pressure, but I want to just present to all of you a lot of the questions that we should be asking. And, all of what we know is right now public knowledge, but there's still more to be learned, to be learned about this, to also be released. And so those are things that are coming up. But that's really important. Tomorrow's a really big day, friends. So I will be following it. I'll report on it Friday. I have just knowing like this, the report that came out from the FDA yesterday, it's really promising. I mean, I got excited about the Oxford AstraZeneca study. And there's still question marks about the efficacy it's not even anywhere near this. 70% in the beginning was like, whoa, 70% is really right. Now we're talking 96%. And we're talking about by day 10, after the first dose, you're getting protection already. In this current state, it's significant. And that's really positive. The big question are for those who may have these pre-existing reactions, allergic reactions, hyperinflammatory, autoimmune. We don't know that yet. And we don't know the role the mRNA plays within their body and any post-vaccine effects. So those are questions that are going to need to be addressed. Now, on the vaccine front, I do want to highlight some things that are happening here in the US. So we have 27 states that right now are not set to get enough vaccine in this first shipment. So we have a vaccine. If tomorrow is a yay, that vaccine is shipping out, like they are ready to go. That is getting on planes. It's going across the country. They're ready to go. And part of the problem is that the priority plan, number one priority is to vaccinate healthcare workers and long-term care nursing residents. And the healthcare workers include folks in that category. These are just some examples. LA their priority plan is to vaccinate 2.1 million healthcare workers. They are only going to be receiving 327,000 vaccines. So that doesn't even hit. That's just not enough. Alabama, they need 112,000 vaccines to meet their threshold of vaccinating 300,000 healthcare professionals and 22,000 long-term care residents. They're set to get just under 41,000 vaccines. New York, New York's priority is to vaccinate nursing home residents and the nursing care workers. It's a total of about, 215,000 individuals. They're only going to get 170,000 doses. So this first round is not even going to meet any of the priority levels. And that is something we just need to get ready. This is going to be slow. Pfizer also communicated some of the challenges in working out the process from the administration and the task force. It's delaying anywhere from 6 to 8 weeks. So that already, we were told, oh, we'll have 100,000 vaccines immediately. That's not true. We are probably looking at 50,000 total by the end of the year. And so, there's some challenges with regard to this process, and it's going to be slow moving. The other thing I saw yesterday was that in regards to this particular vaccine, when Pfizer was communicating with countries and their COVID community task force people, people started to place their orders. And the US, we put orders in a lot of different vaccine buckets. One of the challenges here is that, it's like betting on a horse race. You don't know who's going to come in first, second, or third. And we just kind of did a spread across the board. Well, horse number one is Pfizer, and we have the least amount ordered out of 5 or 6 of the top countries. Like, for instance, Canada has 9 vaccines ordered per person, and they've really mounted a significant strategic effort. I don't know what that looks like for all these other vaccines with Canada and even Australia, but we are going to be behind on ordering unless, we get some sort of more clear process in place. But that's where we stand there with the vaccine. The other thing I just want to communicate, there are beginning to be some surveys that are going out to community of some of the healthcare, and not healthcare workers, but like frontline workers. So, for instance, the fire department of New York, so FDNY, they took a poll of all these firefighters, and they said, how many of you would be willing to step up and get the vaccine? Because one of the things is, if you are in trouble, you're going to be calling 911, and they might send out a fire rescue. And, it's a little ambulance, and it takes you off to your facility, off to whatever, medical community you need to go to. And one of the things that they're showing is that more than half of the FDNY professionals polled said they would not be vaccinated. And that's a challenge that we have. We've got 3 kind of categories of challenges. We have folks that, do not want to have the vaccine for a number of reasons. And I've highlighted, we need more information, help educating and understanding, are there any limitations potentially for, immune compromise or autoimmunity, hyperinflammatory states, and that's very valid. And then there's a category of folks that are a category where we don't have these manufacturers, we don't have enough orders, so we're not even meeting the requirements. So there's just a compound situation, and it's going to delay us getting out of the state that we're in this community spread. So, I think some of the news is skewing it, like, we opted out of ordering all these vaccines. I don't know all the logistics. I don't know you have to put a down payment on this stuff or like how that works. But, in this category, we are the worst case in the world. And we should be number one ordering all of these. And, so that is where we stand. But I'm very excited. I want to talk to you guys about something that can help you support and bolster your immune system naturally. And this is amazing. This is a natural occurring fiber. It's a polysaccharide. It is a carbohydrate. And it is something that you can get very readily in your body through natural resources. You can also have this in extracted, powdered, encapsulated forms. But I want to highlight some studies and some information, some research that showcases the potency of this compound. So, oh, we've got Daisy. Daisy's coming to say hi. You want to say hi to everybody? We'll take a quick little Daisy break. Come here, Mom. Oh, say hi to everybody. Oh, there's Daisy. Daisy saying hi. You can give them ugly smile. Smile, 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 smile. Oh, you're not smiling. Okay, so we have a little Daisy break. You good girl. Say hi to everybody. I know you want to stay. Okay. All right. So Daisy's going to hang out for a minute. So the compound, this polysaccharide, you may or may not be familiar with it. It's called arabinogalactin. And so I have to reference that because it's often hard to pronounce. But the research on this is pretty phenomenal. They have researched this for a multitude of viruses. Some really standard viruses and others a little bit more obscure, like tuberculosis. But what they find is that when this compound is consumed, it triggers a T cell proliferation. And the T cells are part of our natural immune response. They help to trigger an antiviral response. So basically, T cells are an antiviral protection, and it allows the immune system to look at a viral pathogen as an invader and go to town on it to eradicate it so that it doesn't overwhelm the system. It doesn't trigger an overwhelming cytokine storm. And it has a regulatory immune response. And that is really critical for many folks that have, Daisy, I've got all sorts of new supplements in here. Oh, here she comes. Come here, bud. Hi, sweetheart. She's sniffing around. Yes, you're sniffing around. Yes, you're a good girl. She ate one of Gabriel's Mighty Pups. I think she got a little jealous. He was playing with all these Mighty Pups, and she ate one. She didn't eat it, but she just chewed on it, and basically his head's all smushed up. So anyway, this particular compound, it is a prebiotic, and this is really the amazing potency of this particular compound. As Monday's show, I talked about before we had the buffering. I talked about colostrum therapy. And this is something this year I've become certified. I've dug really, really deeply into the potency of nature's first food, the capacity for your immune response, and the IgG, these antibodies. Monday's show, we talked about how the IgG, so big I, little g, big G, those are antibodies that actually help protect you from viral, pathogenic bacterial invasions. Some of the potency of colostrum therapy is also going to blend in very successfully with this arabinogalactin. And it's a polysaccharide that is a fiber. And the density of this fiber makes it a prebiotic. And prebiotics we find in colostrum, we find in yogurt, and we find in dense fiber dense and fermented foods, but we also find it in like inulin. That's a really good artichoke. One of the things that we find is that when we get prebiotics, that becomes a food source for the healthy bacteria. The healthy bacteria is what helps to balance our immune system. And when we have a healthy gut, a healthy microbiome, we have a better capacity to respond to pathogens that enter the bloodstream. And systemically, we have a better immune response. This is where this particular compound, this polysaccharide, comes into play, in that it supports your immune response and it will help trigger all of the right immune responses. So for folks that have already underlying viruses, and one of the main viruses is an extremely common virus. If you ever get a cold sore or have shingles or have genital herpes, the herpes simplex and the pox virus line, if you've ever had chickenpox, friends, this qualifies. Chickenpox is an underlying pox virus that can have dormancy. We can have HSV1. That's where you get a little, fever blister or a little herpes sore on the mouth. We have the genital version. Those don't have to be synonymous. People can have genital herpes, her HSV2 actually register in the mouth as well, or on other areas of the body. But that particular virus profile, that's actually been a clinical study. So when I pull all the studies, arabinogalactin has been studied extensively in its capacity to put an HSV or pox-related virus like shingles or herpes into a dormancy. It can eradicate that viral explosion, that viral recurrence, because this is often, these recur very frequently. Sometimes women's cycles trigger it, stress, a fever. A lot of times we say, oh, fever, blisters, that's herpes. That can be triggered when we have that weakened immune response. And what happens is taking this polysaccharide, and by the way, it comes in a powder form. There are some brands that I really appreciate. Vital, I think it's Vital Protein. Let me see, what is it? No, it's not Vital Protein. It's Vital Support. But I have a link down below. So for all of you on YouTube, you can link that. We sell these in my Full Script store, my patient dispensary. Vital Nutrients is the brand. But this particular compound, it comes from a larch tree, and it is naturally occurring in its forms. So very similar how I recommend mushrooms, fungus or fungi will grow on trees. We find this particular compound in its capacity, it comes from the bark. And so a lot of plant-related protection comes from bark. If you are a tree, your bark is your immune response. It's your immune protection. So a lot of things like chaga that grow on bark tends to be really potent in terms of its immune protection. Very similar, we see this as well, this arabinogalactin. And in the powder form, it can help the digestive process in a number of ways. When we consume it, it actually ferments. So this is positive. When we consume this, we take this powder, you can add the powder, like we mix it up in our yogurts and things like our nut yogurts. You mix this fibrous powder. As you digest it and it gets into the small intestine, it actually ferments, and that fermentation increases our gut microflora, the good healthy bacteria that lives in our gut. It also will increase the lactobacillus. That is a really critical immune response via a particular type of probiotic, a healthy bacteria that creates balance. It also increases short chain fatty acid production, which is really critical. And then we see it minimizing ammonia production. And ammonia is an off-gassing sometimes from unhealthy gut bacteria. And that can become a toxic source. It can become a cytotoxin in the digestive system. So if you're looking at any type of way of improving your intestinal health, if you're looking at minimizing cytotoxins, if you're looking at increasing healthy fiber and a healthy immune response, if you have a weakened immune response or have an underlying viral infection that you're chronically dealing with, this arabinogalactin is going to be a really potent resource for you. And again, I want to highlight the research and the studies on this are quite potent. This compound can occur in echinacea. It also we do see arabinogalactin. It is part of echinacea. It's a compound that is in echinacea. Echinacea, we know, is really wonderful for bolstering your immune system. We also see this in green tea or green coffee beans. And so a lot of times green coffee is kind of utilized, or you'll see it as an ingredient in some of the immune boosting supplementation. Sometimes it's in the immune powders. That this compound is in that as well. And part of that is it's a protection to those plants. But this powder, the larch tree, is in it we find in naturally occurring the way nature has produced this, it's in its most readily available form and easily to extract via the birch or the bark. YouTube, Instagram,